Lebanon, and I joined the obstetrics and gynecology residency program at Hamad Medical Corporation here in Qatar in 2019. So far I'm a PGY2 resident. To be honest, it was a big challenge for me to travel abroad, start my residency program in a wholly new different country with the new work environment and new people. So to say I can say that I'm really proud of myself. I think this was a big challenge for me, and so far it has shaped me to the person I am today. Today in my presentation, I'll be going over. I'll go over some brief history of women in surgery, why to choose surgery and why did I choose obstetrics and gynecology in specific, some main key differences between medical school and residency, what you need to know during your, when you want to choose your residency program, what are the requirements academically, skills you need to have to pursue a specialty in obstetrics and gynecology, my overall experience so far, and some key success and future views. So to begin with, women in surgery, it's not a revolution, it's an evolution. So as we all know, surgery was a male-dominant world, but that is changing. Over the past 5,000 years, women were part of the surgical field. And the first woman to demonstrate surgical practice in the surgical field was the Queen Shubab, which she demonstrated a remarkable commitment to her patients, in which she was found buried with a surgical instrument. They explained it as that she wanted to continue doing surgical practice in her afterlife. However, over the past years, women were forbidden to practice surgeries in the Middle Ages. And there were numerous reports of women who were dressing up like men in order to be part of the surgical field. This was one of the most famous doctors, if anyone know who is she. This was Dr. James Barry, who in 1865 was found to be female upon her death. So she was one of the famous surgeons who were always pursuing, like she was trying to be looking like a male doctor in order to be part of the surgical field. So as we know, for example, pediatrics or family medicine, they have consistently attracted women physicians. But over the recent years, there have been several surgical specialties who developed some strategies and tactics to recruit more women. As we can see here, according to the American College of Surgeons in 2018, there was an increase in the number of female residents attaining surgical specialties from the year 2013 till 2017. And likewise, there was an increase in the active female physicians in these years. But according to the recent data, it mentioned that women make up less than 1/4 of the 10 surgical specialties. And as we can see here, they are least represented in the orthopedic surgery. To my lucky chance that only in obstetrics and gynecology do women outnumber men at a rate of 57%. So moving on to why are there fewer women in surgery than men? The thing is that despite the interest of women to surgery, and that the fact that the female doctors can perform equally well as their male counterparts in terms of knowledge, skills, judgment, and professionalism, women are not actively encouraged to pursue their surgical training because of the social perception of the woman's ability and the gender stereotype. So we as females, this is by our nature, we fear two things. On a professional level, we have the fear of not being equal. So I can just mention a brief example of what I faced during my rotation in obstetrics and gynecology. In the labor ward, whenever we have an emergency cesarean section, the consultant will usually prefer a male specialist to go for an emergency cesarean section rather than a female surgeon. although some female surgeons will be just more senior to these male surgeons. So that's why I think that this gender equality in the surgical profession is really a big issue that needs a big attention. This is on a professional level. However, on a personal level, we have this fear of being alone. And if we are not alone, we also have the fear that we will not be able to successfully balance a career and the responsibilities of our family. So by the end of this presentation, I will mention some solutions in order that we need to consider in order to recruit more women into the surgical field. So why surgery and why did I choose obstetrics and gynecology? Some fun facts about surgery that everyone agrees on, maybe. First of all, training is fun. So every day you will get to face a new challenge, new experience, new case. So all in all, training will be a story you will tell everybody about. You will never forget your training. Second, the pay is not bad. That's what everyone agrees on. Your parents will be proud of you. They will go on bragging, my daughter, my son is a surgeon. Surgeons, they have a surgical personality. And what do I mean by surgical personality is they tend to be decisive. They are well organized, practical, and hardworking. You will be a hero. So if you're ever wondering how to be a hero, this is the job to do it. There is a spirituality. Indeed, regardless of whatever surgery you are doing, you will always change a patient's life, and the patient will change your life at some point. Moving on to why I chose obstetrics and gynecology. Well, this is specialty. When I was in Med 4, I started doing rotations in obstetrics and gynecology, and I felt that this specialty will allow me to address my interests and serve the community effectively. So as you all know, it's divided into two different domains. The obstetrics part, this field in obstetrics, I felt that it will allow me to be part of a really vital, to play a vital role in the patient's life, the life-changing event in the female, which is the birth of her child. On the other hand, the gynecology part also provides me the opportunity to take care of the patient and practice the preventive medicine. So this specialty has a big diversity, and it is quite appealing, like giving me the prospect to take care of women of all ages and be part of this dynamic field that is both, I think it is intellectually challenging and rewarding. And it's been a quite incredible journey so far. So Women's Wellness and Research Center is the heart of obstetrics and gynecology here in Qatar. It is where I pursue my residency program. It is considered one of the biggest tertiary centers here in the country. Just a brief overview of how a day in the life of an OB-GYN physician goes. It's really hard to describe a typical day in the life of an OB-GYN because every day you will be facing new challenges and it depends on where you are covering. So in the wards, you will be seeing antenatal patients and postnatal patients, discharging postnatal patients. In the labor ward, you'll be delivering patients, doing instrumental deliveries, going for emergency cesarean sections. The operation theater will be divided into obstetrics and gynecology. In the obstetrics, you'll be doing elective cesarean sections, and the gynae part, whether it was an elective gynae procedure or an emergency gynae procedure. You will be following up patients in the outpatient clinic, whether they were obstetrics or gynae, and in the emergency, you will be seeing emergency consultations. So it's a little bit of everything. And in a framing advice, to give to anyone who wants to pursue an OB-GYN specialty, most of the time of an OB-GYN physician is spent in the OR. So you must like the OR in order to go into this specialty. I'll be going over some key differences between medical school and the residency that we need to note here. In medical school, you are the student. You are just the one receiving the knowledge from your mentor. Unlike residency, it will be your job. So you are the person responsible for the patient. you're no longer a student. And as years progress, you will be someone independent, taking the full care of your patient. And the main key difference between medical school and residency is the work-life balance. So in medical school, there is always flexibility. You can attend a class, you can skip a class, take the notes from your colleagues, watch a class online like what's happening these days. Unlike residency, there are strict time demands. So once you reach residency, you will recognize that your free time is no longer totally under your control. The patient's life will depend on you. So you are the one who is responsible for the patient. And you'll also start to discover that your time at the hospital, it doesn't always exactly end on schedule the way a class would. So whenever you are scrubbed in an operation, complications might happen. So you need to stay in the OR until the operation finishes, see the patient in the post-op care, make sure everything is fine, and then you can leave the hospital. So you are the one, you are no longer in the backseat. I know it might be tiring, it might be stressful and frustrating, but believe me, residency is really a very rewarding profession. There was a mentor back in our med school who used to tell us that 50% of what you learn in medical school will be useless. The only problem is that we don't know which 50%. So that's the aim of the residency program. So in the residency, we always need to keep replenishing our own knowledge. So, and medical school, it is just like building blocks to your residency. And in the residency, it's where your knowledge starts to take roots and fly. And this is when you figure out that the main purpose of medical school was teaching you how to learn. And one more thing, in medical school, you are taught everything. The mentor is teaching you everything. Unlike residency, no one will come and tell you, this is an interesting procedure, go on and do it. Come learn from here and take this knowledge from here. You need to run behind the procedures. You need to follow the person that you think will help you and will support you. So finishing strong, I know residency will be chaotic and challenging at times, and the postgraduate training is a very critical step in getting where you want to be. So you have to choose really wisely. And you will apply all what you've learned in medical school and have the confidence to work through unexpected case scenarios. So concerning the requirements for this specialty for obstetrics and gynecology, when it comes to academically here in, according to Hamad Medical Corporation, what are the requirements? 1 year of internship, either step 2 CK or IFOM CSE, and an English proficiency exam, TOEFL or IELTS. It is a 5-year program. In other countries, it is a 4-year program. In Lebanon, I think it is a 4-year program. Here, it is a 5-year program in which you will be sitting for your Arab board examination. In PGY2, you will be sitting for your Arab board part 1. And in year 5, you'll be sitting for your Arab board part 2, which is divided into both written and the OSCE part. And by the end of your training program, you will be an Arab board certified physician. After your residency, you can join a fellowship program. Fellowship programs have opened recently here in the Women's Wellness and Research Center, which are divided into 4 categories: the maternal fetal medicine, the gynae oncology, reproductive oncology, and the urogynecology. The skills you need to have in order to be a successful obstetrics and gynecology resident. So first of all, you need to have a good communication skills. Believe me, communication skills is very important, whether you were communicating with the patient, with the other team members. You will always be working as a team, whether it was your colleagues, the nurses. So it is really important. Second of all, you need to show compassion, especially laboring women. Women in labor will be in extreme pain and distress. So treating the patient and the family members with compassion and understanding is really very essential in keeping the trust. You need to have emotional resilience. And Honestly, before I joined the obstetrics and gynecology residency program, I thought it will always end with happy endings. So, but when I joined, it turned out it's not the same. Uh, there are some bad outcomes that can happen that can be very bad on the patient and the family members. So you must be able to cope under pressure in sometimes and in some stressful and difficult situations. Sense of humor. So I mentioned this because I have one consultant who always covers with me in the labor wards. He always used to go inside the room in the patient's room, and the patient would be in labor. She would be in stress. He always used to tell her, and hopefully in the coming 3 or 4 hours we will see you in 2 pieces. So that would just draw a smile on the patient's face. And get her excited to see her future baby. You must be detail-oriented, honestly, especially when getting the history from the patient. Every detail is very important for the patient's care and safety. The physical stamina. Honestly, in OB-GYN, an OB-GYN physician will have to work for long hours, including weekends, overnights, and so they must maintain their energy level throughout the duration of their shifts in order to ensure the patient receive the best quality of care, and that tasks are performed accurately and to the best of their abilities. So in order to maintain a patient's safety, you must be physically well. Manual dexterity. So no matter how intelligent, focused, analytical a surgeon may be, he would be nothing without the use of his hands. And I'm not talking about having the skills before joining the program. The skills will develop eventually with practice and training. And last, you must be patient and polite and respectful to your colleagues, to the nurses working with you. Believe me, it's the most important thing. As long as you maintain a very calm mentality with all the people working with you, it will be worth it in the end. So the challenges you might face in obstetrics and gynecology is that the work will be tough. You will endure tough people. There will always be people undermining your abilities. Some people will support you and some people will not. So just follow the people who will support you. Choose wisely who you will follow. The job can be demanding and stressful at times, and you will have sleepless nights. Complications might happen. Complications might happen in any surgical specialties, and this is one thing I want to mention about. During my residency program, when I started having the privilege to do surgeries, especially a cesarean section to start with, I was doing one cesarean section with a senior consultant. So I was the primary surgeon. The surgery was a straightforward surgery, very smooth. The patient was well throughout the surgery. She went to the postnatal wards. After 8 hours, from her surgery, the patient started to get hypotensive. She was vitally unstable. They suspected an intraperitoneal bleeding, and the patient was shifted back to the OR for a reopening. The next day, I knew what happened to my patient, the one I operated on. To be honest, it wasn't easy to hear this. I was stressed. I was sad to know that this happened to my patient. At that time, there were 2 groups of people. There were some people who took me on the side, told me that complications might happen. Try to learn from this experience. People who do not work will not have any complications. So just let it be a trigger for you to work harder. On the other hand, there were some people who were just pulling me away from any surgical procedure. They thought that mistakes should not happen, and this is not the right thing. So don't be afraid of any mistakes that might happen. Take it as an opportunity to learn from it. by the end of the day and by the end of your career, it is rewarding. Helping to deliver a healthy baby is the best feeling ever you can have, and being part of this extraordinary milestone in a woman's life. You will also face some personal challenges, and every challenge you face will just get you into your personal fulfillment that you are for this job. So the culture of this career, to sum it up, it is sorry. So to sum it up, it is fast-paced, it is diverse, it is joyful when you deliver a healthy baby, and it's hard when the outcome is really bad. So some simple prescription for a successful surgeon: always have a dream, and education is the key. So don't think that education will stop once you start your residency. You are always in a continuous learning. Find your passion, choose whatever surgical specialty you like, and go for it. Be sure that this specialty you will be doing for your whole life. So have the courage for challenges. Face your challenges. Don't let anyone undermine your abilities. Embrace opportunities. Whenever you have the chance to go for a procedure, go for it. Don't let your ability. Don't think that you're not able to do this at a certain level. And always have a personal support system. I think this is the best part of it. There was the Dr. Anne Laurie in her presidential speech at the American Society of Colon and Rectal Surgery annual meeting. She said that two roads diverge in a wood, and I took the one less traveled by, and that has made all the difference. So to sum it all, as I mentioned before, we need to remove the barriers from letting women pursue a surgical career. And as we can see, these days, number of women in surgery are slowly increasing around the globe. And the change will need to start at an individual level from us. So some tips that we need to implement in our society, some fundamental and long-lasting social changes on how people perceive the role of women within the society, and that the person's career opportunities should not be limited by gender, race, or sexual orientation. So to sum it all, when you feel that the things are even, and when you feel that work isn't overshadowing home, and home is not taking you away from things you need to do at work, it is at the end of the day when you lay your head down and feel at peace. That's life in balance. I can summarize that women in surgery, it is just life in balance. I hope that in the future, women will grow in a society that really accepts and values them as equal. I hope the world becomes just a safer place for female surgeons where they are respected and valued. Thank you so much.
Thank you so much, Doctor. I think we have time for a few questions. If anybody has any, you can just leave them in the chat box.
Yes, sure.
So
concerning getting a spot in obstetrics and gynecology abroad, especially in Europe, is hard. To be honest, as long as obstetric and gynecology is a surgical specialty, it's considered a competitive specialty. I cannot just judge about Europe. I don't have any experience in Europe, so I'm really sorry if I'm not able to answer this question. That's my answer to this question. What made me choose a specialty in Hamad Medical Corporation? First of all, I was my aim was to choose an ACGME accredited program, and the only two options I got was the American University of Beirut and Hamad Medical Corporation. I applied for AUB, but unfortunately, I didn't have the chance to join. The only option was Hamad Medical Corporation, and I've heard a lot about the experience of OB-GYN at Hamad Medical Corporation in a way of the workload. Obstetrics, especially obstetrics, rather than gynecology, is like we have like 19,000 deliveries per year. So the workload is big, and for for accepting 5 residents per year, the number is quite good to attain a good surgical practice. There was one question that mentioned, you talked about dealing with death and people pulling you away from surgeries. Is this always due to doing a mistake, or what leads to that? So concerning death and complications in surgeries, death, what I mean by death, sometimes the patient, for example, might get an intrauterine fetal death for no definite reason. And this is something that it's no one's mistake. It just happens. It's all about counseling the patient, talking to the patient and her partner at some point. But concerning complications in surgeries, some complications might happen because of a doctor's mistake. So it is always, some complications also happen with senior consultants. So it's not about, it's all about just learning from your mistakes. And whenever the complications happen, the patient will already be informed prior to the procedure for any complications. That's why a patient might sign a consent of all the complications that might happen. We try our best to avoid complications in surgeries, but some things might go wrong unexpectedly. That's really a nice question. Did you face any problem in surgery with the fact that you are veiled? Honestly, I've never faced this problem, whether it was in my medical school or in my residency. And I think currently the things are changing, especially when it comes to laboring women. They've always, most of the women, they are preferring a female surgeon. And the society here in Qatar, it really appreciates, I think, a female surgeon and a veiled one. So I think this was something very positive for me to be working in this community here. Is it hard to coordinate between OB-GYN life and the personal life? As a resident, look, as a resident from the beginning, usually the first 2 years are some tough years, especially when you have tough rotations. For example, as a PGY1, you will get a 4-month rotation every day, 12 hours in the labor ward with like 1.5 days off every week. And you will get 1 week night shift and 1 week day shift. This is kind of tough. It is a tough rotation, but with the coming years, rotations will be less hectic. You will be able to manage the residency program and your personal life. Look, it's all about time management. Believe me, if you planned your life very well, you will be able to manage both things. And thank God, I am so proud of myself that I'm able to manage both things very well. Do you think starting a family during your residency year is as hard as it might seem? Well, if I was considering starting a family in my first 2 years of my residency program, I think it would be hard for me or for my partner or anything. So I think starting a family, starting from the 3rd year is quite adequate to manage both things, so that you will be able to balance both. Is it hard to apply to HMC? Honestly, it's not hard. And I had a view that I might not be accepted at HMC because they might go for nationals more than foreign students. So it's not about hard. It's about your the requirements, what you apply for, and this about the interview and the chances. It just depends. It's not a matter of hard. You can apply. Everyone can apply to HMC. So just have a good CV, have good grades, and just apply. Just give it a chance. Any other questions? Thank you so much for inviting me to this presentation. Really, thank you so much. And if you want my contact number or my email, you can feel free to contact me at any time.
Okay, thank you very much, Doctor.
Thank you.